vessels is most likely occluded in this patient. A 56-year-old man presents to the emergency department with sudden onset left-sided weakness, difficulty speaking, and facial drooping on the left side. The symptoms began approximately 90 minutes ago. His blood pressure is 160 over 90, and he has an uncontrolled hypertension, a history of uncontrolled hypertension. A non-contrast CT is performed and shows no evidence of hemorrhage. Which of the following is most likely occluded in this patient? Okay, so left-sided weakness, difficulty speaking, and facial drooping. Okay. I'm gonna go ahead and get rid of PCA. There's nothing here about vision issues. Basilar? Oh, I don't know. So usually with ACA and MCA, I believe ACA will talk about like, I believe it's like lower body weaknesses, and MCA is like facial weaknesses and upper body weaknesses.
Okay.
And they usually talk about that because there's facial drooping and difficulty speaking. I'm gonna go ahead and get rid of ACA, and I'm leaning towards MCA right now, but um. There's a lot of to me. There's like a lot of stuff that I don't know. Left side of weakness is really vague.
Okay.
I don't think it's internal carotid. It could be basilar. I don't know. Um,
So if you're not sure, what do you want to go with here? C or E here?
I'll go with C.
Good. That's your best answer. So let's work through this. So going by test taking strategy, right? It's kind of always at 50-50, especially with you, right? And so I want you to always remember, right? That last step in your question strategy is to ask yourself, once you pick your gut, you want to ask yourself, you want to keep it or change it, right? And you really don't want to change it unless you have a good reason, right? And if
Yeah.
you remember your vertebral or basilar artery, that's the things that are going to be very, very severe, like locked in syndrome and things like that, right? Your basilar
Yeah.
artery controls so much of that brainstem that if you have an infarct there, you're in trouble, right? Like you're either completely brain dead or you're going to have like locked in syndrome, which this patient doesn't have, right?
Yeah. No, exactly. I was trying to remember what that was. But yes, locked into it's bad. Just think
Yep.
about yeah.
Super, super bad. You can't move except like your eyes, right? You're consciously still there, but you can't move any of your body except your eyes, I think, in one direction, up and down, if I'm not mistaken, or left or right, one or the other, but not great, right? And so, but in this particular instance, right, they give you left sided weakness. So you can assume that it's, the face and the left side of the body, right? And
Mhm.
so the best one that's going to fit that is going to be your middle cerebral artery. Your anterior cerebral artery usually does like your feet, right? For the most part, posterior cerebral artery, vision, internal carotid artery, that's too vague, right?
Yeah.
So best answer here is going to be C.
Cool.